Yeah, so when I was 14, going into high school, I went into the foster care system in New York City. And while that is typically a very an outcome that is not good for kids, right? Most foster care kids do not fare well. High school dropouts, pregnancy, all of those things. But I was very fortunate to be in a private foster care agency who really provided us with lots of mental health support. I remember it was groups every week, and it was also one-on-one with a psychologist. And it was through their support and through that mental health support that my confidence was changed, right? And my ability to think that, oh yeah, I can go to college and I can do that and I can be that, because I know that otherwise I wouldn't have done those things. And so my attraction to the School District of Lancaster was that these are children who look like me, who came from poverty like me. And I thought at that time when I first started, I can make a difference for these kids. I want them to see that through the right support, you can be somebody. So, poor school districts like the School District of Lancaster, our students often do not have access to mental health professionals. And that impacts their ability to form social relationships, to really engage in school, to focus and concentrate. And so that's one of the areas that I really was concerned about. So when I went to the School District of Lancaster, my first year, I interviewed tons of people, and I also interviewed our school counselors. And they all said the same thing: our kids need mental health support. And so I was able to convince the board, year 2, to hire 20 social workers.
Wow,
Because
20.
yes, they really understood, and I gave them the data. Attendance was low. Behaviors were poor in many places, especially the middle and high school. And so they understood that in order for our kids to be successful, to be whole, they needed mental health support. I think that after COVID, when we saw our students return with so many mental health issues that were exacerbated by being isolated, we said to ourselves, we really need to provide additional services to our students. And so I think that created a sense, not just in our school district, but across the community, that mental health services are urgent, right? Because they are the foundation to student success. We talked about having kids have mental health education in the curriculum, so students would know that it's okay to not feel well, it's okay to go to an adult for support, and that our teachers were then able to recognize what are some signs that you might be seeing that tell you we need to intervene immediately. And that's why organizations such as your own are so important, because collaborating and partnering with school districts is so urgent. Our kids need as much support by mental health professionals as they can get, so that they can be successful, so that they don't fail school, so that they don't drop out of high school, so that they don't get involved in crime. And so, I believe society as a whole is much more open to the need for mental health supports. So after COVID, well, actually during COVID, there was that time when every school district was debating, do we bring our kids back? Do we bring our kids back? Because we didn't know about COVID and what could happen. And there were so many parents who called me or emailed me and told me about some of the struggles, mental health struggles that they were seeing with their children. Children who would not leave their rooms. They were isolated. Beyond school, they were just isolated even from their families. They were eating a lot, gaining a lot of weight, being very angry. Parents saw some violence at times towards them, because their children were not, one, getting the mental health they needed to address all of those issues they were having.
Yeah, all the emotions that they were feeling.
And we saw it when they came back. We saw that they were having trouble making social relationships with others, with working with teachers and others. And so the importance of providing them the mental health support they needed was even more urgent, and continues to today.
Yeah.
one of the most important things that has increased but needs still to increase even further is advocacy, right? And advocacy comes along with advocacy for resources, so that school districts across the Commonwealth can get the mental health support. And so I think your organization providing that advocacy, in addition to actual providing the counseling for students, is urgently needed. Helping legislators understand the problems, helping them develop policies that are good for kids in terms of mental health supports, trying to get the correct ratio in school districts. And I think that organizations such as your own can really help with that, because it's a well-respected organization and our legislators would listen to that. And, so one of the things that the School District of Lancaster has that many other school districts don't is we have what we call community schools. So they are places within the school building, but it's for the community. And we look at what does the community need? And oftentimes, especially for parents who are struggling to meet the needs of their children, is for parents themselves to get that mental health support to help them develop that stronger relationship.
More comprehensive.
Yes, for them to understand why students are behaving a certain way and to help them parent. And working with staff, right? So one of the things we saw, and one of the reasons I hired so many mental health staff was because we were having kids acting out, and as a result, there were lots of suspensions. So kids being out of school doesn't help them, number one. Number two, when they're out of school, they're more likely to engage in juvenile crime, right? So we need for organizations to train our staff to be able to identify when is the child in crisis, even prior to that, some early intervention, so that our staff can provide some initial support while we get the student support. And it has to be accessible quickly, right? It can't be, that's why we need organizations like yours, right? It can't be, we'll get you a counselor in 3 months. No, we need somebody next week.
Thank you so much for joining us today, and thank you for all the work you've done and continue to do.
Thank you so much.
Thank you.
My pleasure.